Hey everybody, how are you? Hey, this is Sam. It's been a while since I made a video. Hope everybody's doing well. And well, anyway, I'm making this video because in the next 3-4 days, I'll be heading into a hip revision again. Uh, the reason why I said again is because I supposed to have the hip revision done in January. I actually made a video and talked about that, but when I was in the preparation room, something happened. I had chest pain. I think it was with some medication that came into me. So I had chest pain, and the surgeon didn't think it was safe, so he canceled the surgery. Now I got everything checked out, chest, x-ray, and was at the heart, angiogram done, stress test, everything done. It's all good. So here I am again, making the second attempt to have my my hip revision. So I had my hips replaced 27 years ago, but during those days the surgery was supposed to last about the components supposed to last about 15-20 years, but I think I have overused it already. It start wearing out, so I have to get this done. Otherwise the surgeon said if it starts wearing out and I get it done, then it could be a problem. When the plastic starts wearing out, it gets into the bones, that it could be crunchy, and at that time they can't mount any screw in there, so I guess at that time I'll be screwed, really. So yeah, I just need to get it done. I'm gonna have a left hip revision, and actually I'm gonna have both. I had both done, so I'm gonna have the right hip done after that, so one at a time. Yeah, so yeah, I'm taking this opportunity to be out here playing some golf for some people to hit before I walk. I'm done for the day. That's kind of late, and I just want to get every thing in, every moment in as possible before I get my hips chopped up again. So yeah, I'm just trying to take my opportunity to enjoy some times, and then at the same time, getting some energy. I've been walking a lot, hopefully getting as much energy as possible, because going into surgery, it's not going to be easy, at least the recovery. So trying to be as healthy as possible, going to the surgery. So anyway, I'll keep you updated. I guess the second half of this part of the video is when I'm done with the hip surgery and starting my recovery. Wish me luck. See you in a few days. Let me go over some of the pre and post surgery requirements and things to do, what equipments to get. So pre-surgery, there's a lot of requirements, what to do, and here's the paper from the hospital. Now these would varies between different doctors and different hospitals. Doctors has different way of telling you how to basically prepare for the surgery. I am having my surgery at USC. I need to do is I need to get this hibis clean. Start taking a shower with this 6 days before the surgery, and basically this kind of help cleans the antibacterial. And then the day before that, after shower, after hibis clean, then I will use this wipe, so another antibacterial wipes. But when I wipe my whole body with this, I do not rinse it off. I just keep this thing on. There are some medication sheets in there that kind of just cleans the, kills the bacteria and all that stuff. Now, this could be, if anybody has any skin allergies, You're gonna have to talk to the doctor. I have itchiness. I used it the last time since my surgery didn't go well. I used it the last time. I got itchiness, but I did not get rash. Or you get rash, that's a different story. So you're gonna have to tell your doctor. And then on the day before surgery, they want me to be hydrated, very hydrated. So I need to drink like 8 cups of water throughout the day just to keep myself hydrated. And then when on the day of surgery tomorrow, I will have 2 cups of water before I go to the hospital. And that's just to keep myself hydrated again. There's no food or drink after midnight or 6 to 8 hours before that. That is very normal. Now, more importantly, are medications. Now, the doctors told me not to take any of the blood thinners. I am not on any blood thinners, but any of the non-steroid anti-inflammatory drugs are blood thinners itself. They want me to stop this 6 days before that, show on another page here. Also, I need to stop all of the vitamins and supplements for a week before the surgery. Biologics goes, I was told by the pre-op doctor. He said to skip my next dose until the surgery, until a week after the surgery. It's mentioned on the sheet here, any medications for the heart, the lung, diabetes, asthma, any of that other medications should follow the instruction of the doctor. Now, these are equipment for post-surgery. So this is the shower chair. It's going to help me take a shower and not standing there too long and put too much weight on my hip. And this is the commode for the toilet. For the time being, I don't know how many weeks, I cannot sit at a 90-degree angle with my hips. So it is suggested you get a toilet commode. These are hip surgery tools, such as the sock helper, the dress helper. This is the shoe helper, and then the shower sponge, and the dress hook. Well, it's on my hip, so I probably don't need this, but definitely these are going to be very useful, especially this clips and then the sock. So this, you can get on. I got all these on Amazon. This thing is fairly inexpensive on Amazon, and these as well, and it is cheap. These are not provided by your insurance, so they don't pay for it. So unfortunately, but lucky they're not that expensive. And then one other thing, this is the leg lifter. So I was told to get one of this because after surgery, after the hip replacement, the leg is going to feel like 1,000 pounds if you have to lift it up just to put the feet on the bed. And this is going to help by putting the feet there and then using your hand to lift it up and then ease into the bed. So yeah, this is all suggested by the doctors and the nurses over there for post surgery needs. And the other thing that basically for me I need for surgery, after surgery, post surgery, are snacks. So I got cookies, pineapple cookies, sunflower seed, nuts, vitamin drinks, protein drinks. And then for entertainment, got my TV, got my PS3, PS4. Yeah, I'm still on a PS3, PS4. So yeah, all these are going to be my entertainment, and no, that's a no. That's just here for decoration, okay? Not drinking that. So these are all the post-surgery and pre-surgery requirements. Forgot, I also got a pair of crutches, ready to go as a helping hand when I get home, because technically I'm not going to be able to walk on my feet for months. I don't know what the hospital is going to get me. They're probably going to get me a walker when I'm there. But when I get home, this is going to be my walking helper. And just like that, the surgery is done. The whole process, I was told by my sister, it took about 90 minutes, which is a lot quicker than what the nurse was telling me for the 5 hours. This is an x-ray image right after the surgery is done. The right hip was my old replacement, and the left hip, the newer rotator cuff, as you can see, it's a much bigger rotator cuff, because the doctor said since this is a revision, there's more chances and more opportunity, and it's easier for me to pop the joint. So he puts a much bigger and a newer rotator cuff on there. And then to seal the opening, you can see that there's a bunch of staples on the left hip over there. So that's my new hip at this moment, and it's completed. Hey, good morning, everybody. Well, this is my second day after the surgery. They had me sitting up on a chair already, so there's my bed over there. So that's a good thing. They're certainly moving a lot faster than my initial hip replacement many years ago. Things are so much better these days, so much more advanced for sure. They had a drainage tape on top of the incision at the moment. So I'll see if I can take a picture of that later. It doesn't look nice for sure, but they did have me sitting up already, and everything looks good. Oh my goodness! Yesterday I was so under the medication, I just could not stay awake. It took literally almost a good 15 to 16 hours before everything clears up. When discharged home, there's a bunch of instructions and home care that needs to be followed. Things like exercise twice a day, but don't overdo it. Walk twice a day, just kind of light walking, and then increase gradually as the day goes on. And then weight bearing is based on what the doctor would allow you to put weight on. And he's started me with, as much weight as I can bear in the beginning, which is actually pretty good. Make sure getting enough rest. Every time after an exercise, I need to take a rest. And it's the best to ice it up after exercise, but do not ice it more than 20 to 30 minutes at a time. There's a lot of don'ts that you're not supposed to be doing. Do not sit on low chairs, sofas that can kind of soak you in. Do not lean forward when hands, touch more longer than the knee. Do not twist and turn the body, that's for sure. And definitely the knees cannot be turning inwards, and no crossing the feet. There will be an in-home nurse that's coming out 3 times to check on the progress, as well as replacing the dressings and removing the wound vac. I also need to do a set of exercises that's given to me by the hospital, as well as the physical therapist over there, and it's approved by the doctors. So there's a bunch of stuff that needs to be aware of when I get home, and needs to follow these instructions closely. Otherwise, there could be problems. And if there is a problem with, more pains, if there's any drainage, I need to contact the doctors immediately, because there could be an infections or anything of that sort. So yeah, there's a lot of stuff to be followed, and then medications that needs to be taken according to the instructions of the doctors, as well as everything else. So yeah, it's not an easy task. So I've been home for a couple of days after my hip surgery. So they sent me home with a wound vac. This thing. They get a vacuum on the incision site. So they got me home with this Provena wound vac. So anyway, they said I need to have this on for 7 days, and I got some lights here. 2 of them's already gone out. Well, I already I was in the hospital for 2 days, so they had a bigger machine over there for that. So they sent me home with this thing, 2 days. Now I got some nurse coming in next week to take this off for me, and they said this wound vac would help the incision close faster. So yeah, technology is moving on from 30 years ago. And I'm walking with my walkers on the meantime because I can't put too much energy on the surgical leg right now. So it's gonna take a while. I was in the hospital for about 2 days, which is not so bad. My initial surgery back in 1995 and 1996, I was in the hospital for about 7 days for the first 9 days in the hospital for the second replacement, and been in ICU for quite a few days. They got me out quite quickly. I was told that the whole actual procedure is finished in about 90 minutes, and then I was out into the recovery room for another 2 hours before they put me into a room. And from there, I just couldn't stay awake on the first day because it was so drowsy with the anesthesia. My God, they want to get me up on the same day already to get moving. I just cannot stay awake. So yeah, I went in on Tuesday morning and then discharged on Thursday. And so far everything has been doing okay. The pain is very minimal, not that high. So I've not been taking any painkillers. It's not that bad. I've been using ice to ice it up. So doctor said I should not be sitting for too long. I should not be walking for too long in the beginning, and just kind of cool off for a little bit. Sit for an hour, a little bit over an hour. Sit, maybe do a little bit of walking, and then lay down. He doesn't want me to be lay down for too long as well, because you need to get moving as well. So yeah, it's a combination of everything that needs to kind of get the hips going, and do some of the exercise that they giving me. So yeah, it's gonna be a little while. The other bad thing is not with the pain, is the medication that they gave me. They gave me 2 types of antibiotics. Oh my God, the antibiotic is killing my guts. Having diarrheas now, and so I'm gonna have to call the doctor and see what they can do with that. And yeah, my guts does not handle antibiotics too well. And then they also gave me some non-steroid anti-inflammatory drug. Oh, I was feeling all the side effect from it. So yeah, Monday comes around, I need to give the doctor a call and see what he wants me to do with the... Hey everybody. So today is day 7 of my surgery, and I just got a nurse came into the house and removed the wound vac and replaced it with a different Band-Aid that is it has antibacterial substance in there. So he said put that one in for another week. I guess I have another nurse coming out in a week to replace that as well, and then I should just be on those regular Band-Aids. So yeah, anyway, everything seems to go well. At least the surgery is well. The pain kind of comes on and off. Not really that great, but last night it kind of came on a little bit more than I expected. And then the last couple of days, I've been taking a lot of antibiotics. Antibiotics just literally kills my guts. So I messaged my doctor. He said just go ahead and stop the antibiotics. And there's also another anti-inflammatory drug that I mentioned the other day. It was Indocin. It's the Indocin medication. Oh my God, that's giving me a whole lot of side effects, including nausea and vomiting and everything else that I don't want. So he said stop that as well. So I'm basically just down to taking aspirin for blood clot. So yeah, so that's all I'm taking at the moment. Temperature seems to rise a little bit. Still under 100, low grade fever. I talked to my doctor. He doesn't seem to be worried about it at all because he said, going through a surgery like this is not a small surgery, and including the ankylosing spondylitis and everything else in the body, there's a lot of inflammation that can also cause a minor fever as well. I'm hoping there's nothing major with the infection or everything else. So yeah, I'll keep you updated, see what's going on. This is day 12 after my hip revision surgery. The healing process is coming along quite well. As a matter of fact, it's actually better than I expected. I'm not having much pain at the surgical site. However, what's really killing me is, again, my stomach. Even if I stopped the antibiotics almost more than a week ago, I'm still having stomach cramps. Now I went out and my GI wanted me to do the CTAP test to make sure that the antibiotic did not induce a certain bacteria in my colons. Go figures. One thing that can fix you, but also can cause something else bad to happen. So yeah, I'm still having diarrhea, having cramps in the stomach. The other thing that is kind of coming on is I think my body is building up a lot of inflammation because I have not been on a biologic for 2 months already. So my immune system, I think it's already going upwards. So my body is building up inflammation. I'm trying to get a hold of my doctor to see when I can, get back on the biologic, hopefully to suppress these inflammations. So my mobility, even though my hip is not that great with mobility, but I can feel my body stiffness, the pain on the neck, the pain on the muscle, and the shoulders are coming on. So yeah, you get some, you lose some. So, but at least the surgery is coming along very well. I'll check back in another day. I'm also feeling some eye pressures coming on in my eyes here. Personally, my autoimmune condition, it can develop uveitis, and the reason why I have stomach cramps is also I have IBS. So those are the bad things about my multiple autoimmune conditions. So yeah, I'll check back to see when I can get back on the biologics and let you guys know how everything goes. Today is day 13 of my post-surgery for the hip revision. Well, I was able to get a hold of my doctor about getting back on the biologics, and he said he wanted to see me before he said okay. So I went over and see him. He said my incision is coming out very well. It's all healed, at least in the upper side. Inside, we don't know. But so he actually also told the nurse to take out all the staples already. So that's a good sign. And then he said it's okay to get back on it. As soon as I got home, I got back on my biologics because it's been almost 2 months since I've been out of it, and I can just felt the inflammation just running through all my veins, and I'm getting pain everywhere in my body, shoulders, and then my neck as well. So yeah, it's been 2 months. So that's how bad the autoimmune, the inflammation has gotten. So anyway, but at least the hip surgery is coming along just fine. Hi everybody, hope you are doing well. Well, today is my post 3 weeks after my hip revision. Actually, it's 2 days past 3 weeks already. I saw my surgeon on Monday. Today's Thursday. I saw my surgeon on Monday, and we took some x-rays. I put it up here. And he said the revision and the surgery site is coming along very well. It's healing much quicker than I expected, which is great. Now, all the staple has been removed, as I mentioned before. I can shower, but no bath. So you don't want me to sit in a tub and soak the meat into the water. So yeah, I can shower, but no bath. And my doctor didn't want to start the physical therapy yet. He said give it another couple of weeks. So the next time I visit him, he might be ordering some physical therapy. So at this current point, he said I can actually put full weights on there, and it kind of surprised me because, when I initially had the surgery 20-something years ago, 3 weeks I can barely. The doctor barely wants me to touch the floor rather than putting full weights on there. So now I can actually put full weights on there, but I still need some support. I cannot walk freely yet. So I still got my pair of crutches right here. So it's going to be probably another couple weeks or 3 weeks before I can maybe feel comfortable enough to get rid of the crutches and maybe use a cane for a few weeks before I can walk freely. So, but it is coming along quite fast. So the x-ray that I just put up here, basically he puts a much bigger incision, not incision, but much bigger parts in there. If you look at the one on the left comparing to my previous one on the right, it's bigger. So I am actually extended by half an inch. Previously my feet is a little bit longer. Now adding the bigger parts in there, I'm actually gaining an inch. Well, I'm still gaining an inch, so it's pretty good, huh? Getting an inch here and there. But anyway, at least I'm getting an inch somewhere else. So, but the doctor said when I do my right hip, he's gonna put something in there to kind of counterbalance it a little bit more. So, which is good. Oh, also he mentioned that I should start shifting some weights over to the left side, because since the surgery, I deliberately kind of like slanting myself towards the right side, just so I can, not hurt the left side or cause any more damages to there. So anyway, yeah, so I can put full weights on there, which is great. I am still walking slowly with a pair of crutches, and in a couple of weeks we'll start the physical therapy, and everything is coming along very well. I almost forgot one most important thing about this whole hip replacement revision experience, and that is you cannot do this alone. Definitely you're gonna need some help. I'm actually very fortunate that I live with my mom and my sister, and they actually help me a lot. As simple as somebody can get you food, or somebody can get you an ice pack. There's a lot of stuff you cannot do. Although I have all these helpers to help me dress or remove my garments and all that stuff, but certain stuff you just cannot put that on, like a compression sock. The compression sock is so tight, the sock helper is not going to work. So somebody has to put that on for you, because you cannot bend your leg and knees to the waist level. And if you drop something on the floor and need somebody to pick it up, you literally cannot do that. And while you're holding a walker or a crutches, as simple as getting a cup of water into a certain area, to your desk or something, you cannot be done, because you don't have 3 sets of hands or 4 sets of hands to hold it, because you need the other hand for the crutches to support your body weight. So yeah, you need you definitely need someone to help you out for at least a few weeks. I'm thinking maybe a good month. When the body has more energy, the leg has more energy, the pain has gone away, and then the doctor said you can put a little more weight on it, then you can kind of loosen up a little bit. But still, getting around without being by yourself is just not going to work. Navigating this whole hip replacement revision by yourself is not going to work. So having good help, it's a must. It's not just mandatory. I mean, it's not just a suggestion. It's really a must. So as I said, I'm glad I am fortunate that I have family members around to help me out with a lot of the stuff, cleaning up sweeping my floors and all that stuff. Yeah, I am very thankful. So I am going to end this video here, otherwise it's going to go on forever and forever. If I have anything else that comes up, I'll definitely add on to it later on to a different video. But I am going to end this video here because of the surgery. I don't want it to go on for too long. So anyway, if you like my video, please give me a like, and if you want to, please subscribe. I'll have some more videos coming out and sharing my experience, and hopefully other people can relate to it and maybe share some information back to me with how they're dealing with how you're dealing with your issues as well. And I want to share my experience with you guys for what I have been through, and hopefully some people can be aware of this disease. So anyway, thank you again for watching. So again, please subscribe, like my video, and I'll see you on the next one. Take care. Bye bye.